So I just wanted to make sure we covered a couple neurophysiology things that are going to sort of creep their heads in some of the things we talk about and maybe aren't otherwise taught, and I don't think are well represented in some of board prep resources, but can show up. The first of them is memory, right? And so sort of what is memory and where does it come from and how do we do it? There's a couple structures that I just want to name. So the hippocampal formation, kind of the medial temporal lobe, is what I want you to associate most tightly with memory. There's sort of surrounding areas of it. One of the words you might see that might be a little buzzwordy is the entorhinal cortex. And so those two kind of work together in order to facilitate both our short and long-term memory, as well as other types of memory that I won't go into. Consolidation is basically how we take short-term memory, right? If I gave you a list of numbers to hold in your head and moved them into longer term, right? So things like a phone number that we memorize for a long period of time, rather than just numbers we can hold in our head randomly for a few moments. This uses a process that you might see called long-term potentiation. And so that basically every time you use it, it gets stronger. We have the opposite thing in our brain, places that we don't use gets weaker. Right? I don't think you'll ever be tested on the neurotransmitter. I've never seen it in a question, but you should know that glutamate is important for these things. You will be tested often on amnesia. And so I think it's important to separate when people have an anterograde amnesia. So that's the ability to take any new thing, anything that I have in my short-term memory and integrate it into my long. And then retrograde amnesia, which is a little more uncommon, is the inability to recall events that happened before, right? So if someone has a traumatic brain injury and can't remember things that happened before that, I would think of that as a retrograde amnesia. Versus anterograde, someone has a traumatic brain injury, you just met them, told them your name, 5 minutes later, they don't remember your name.